Hey, welcome back Not So Complicated, and today we'll be talking about every fossa in the human body, the contents, the boundaries of this, the clinical anatomy of this also. So, cubital fossa, popliteal, infratemporal, pterygopalatine, and ischiorectal fossa, these are very important in the clinical point of view and also in the exam point of view. You have to learn to draw these, alright? So, let's begin from the cubital fossa. So, grab a white paper right here. So, this is the cubital fossa. Actually, there are different boundaries like given in the figure or shown in the figure. So we will have to learn to draw this for the exam point of view. All right, so grab a paper and then different color pencils that you have, if you have. All right, so this makes our superior border, that is epicondylar line. This is an imaginary line between the two condyles. All right, so this makes our lateral border, that is made by the brachioradialis, that is the muscle, and this is our medial border. All right, so this is formed by pronator teres, and this right here you can see a inverted, this is an inverted triangle. All right, so this is the content, like medial to laterally. We will go from medial to the lateral. The contents are, there are 4 different contents, and these are MBBR, not MBBS. You have to remember, like MBBR. This is the first one, and this is median nerve. All right, so this is the second one. This is brachial artery, and this artery will then divide in this cubital fossa by making 2 different arteries. This right here is the third artery, that is radial artery, and this is ulnar artery in the medial area. All right, so that will form like ulnar artery, and along with this brachial artery there is a brachial vein like this, and that will also branch into 2 different veins, and this will make radial vein, and this right here will make ulnar vein. All right, so this right here is the, like the next in order in MBBR is B. All right, so that B is formed by biceps tendon, and this is formed by the aponeurosis of the biceps tendon, and then the last one is R. All right, so that is formed by radial nerve. So you have to label it like that, and this radial nerve will again divide into 2 different nerves. This makes the superficial like radial nerve, and the other one is deep radial nerve. All right, so this is how their contents will be managed, and the most important thing out of that is there will be another vein right here, and that is what? Median cubital vein, and that median cubital vein is used to extract the blood for venipuncture. All right, so that is how it is needed, that median cubital vein. And why medial cubital vein? We will be talking about that, because the vein of choice for venipuncture, because it is connected to deep vein by perforator vein, therefore it does not slip. It does not slip. All other superficial veins slip, and that is why there will be the chance of rupture or slippage while doing the venipuncture, except for median cubital vein, because it is stabilized by that perforator vein and also bicipital aponeurosis, right? So that is how we complete our cubital fossa. Now let's continue to the popliteal fossa. All right, so this right here is the actual image of popliteal fossa. You can see there is a diamond shaped structure forming, like a space forming in between these 4 pieces of muscles. All right, so that is how we will learn to make it. Let's begin without any further delay. So grab another piece of white paper. So that is how you make. This is superomedial border. This makes superomedial border. Like we can divide into like the borders can be divided into 2 different parts first, that is superior and inferior, and each of this superior and inferior can be further divided into lateral medial. All right, so there will be 4 borders because it is a diamond shaped structure. So this right here is the superomedial, and that is made by the lateral border of semimembranous. All right, so this makes superolateral, and that will make that will be made by the medial border of biceps femoris. All right, so you can see here, so medial is made by the lateral border and lateral is made by the medial border. All right, so talking about the inferomedial border, this is formed by the lateral border of medial head of gastrocnemius. This might be confusing. All right, so but you can look at that in a detailed way, and you can devise a pattern to remember this. All right, so there will be another border, that is inferolateral border, and that is medial border of lateral head of gastrocnemius. That is like exactly opposite in each other. So the muscle is also same in the case of inferior borders. All right, so that is gastrocnemius. So talking about that, this makes the border of the popliteal fossa. Now talking about the contents, this is the nerve right here, and this nerve is actually tibial nerve. All right, so this is the another nerve that is common peroneal nerve, or we can say that is a common femoral nerve. All right, so sorry, fibular nerve, that is common fibular nerve also. So talking about this content right here, this makes popliteal vein, and this makes popliteal artery, and this artery have a lot of anastomosis, and these are a few that I have made to interpret the anastomosis and the connections with the other arteries. All right, so that is how these three are the main contents, and you can look at it right here. There is different orders in the upper half of this diamond shaped structure and lower half of this diamond shaped structure. All right, so there in the lateral to medial way you can see nerve, vein and artery, but in the lower part there is artery, vein and nerve, right? So this is like demarcated in the medial part of this diamond shaped crystals. You can formulate two different triangles in here. All right, so these are the other contents, and these are the lymph nodes. All right, so the lymph nodes are the crucial important structures in the popliteal fossa, and these right here you can see, you can guess what are these. These are popliteal pad of fat. All right, so these are the popliteal pad of fat. That is how popliteal fossa's contents are marked. So that is how you have to make it. Until now, these structures are very easy to make and very easy to remember, but in the upcoming fossa, you will be finding it tough, but I will try to make it very clear, loud and clear. All right, so that is how we jump into infratemporal fossa. So by the name, you can say that the fossa lies below the temporal bone or temporal area of our cranial vault. All right, so that fossa lies in there. This right here, you can see very complicated structure. All right, there are a lot of contents in those fossa also, and boundaries are very rough. All right, so we will try to uncomplicate it just like our channel says. So let's begin. So we have to make what? A four-faced inverted pyramid. Keep that in mind, keep that in head. We will be making a four-faced inverted pyramid. All right, so four-faced means four borders and the superior border, because there will be a inverted pyramid. All right, so let's begin. And this right here makes lateral wall, and that is made by the ramus of mandible, and this right here makes medial wall, and that is made by the lateral pterygoid plate of pterygoid process of sphenoid bone, pharynx, tensor veli palatini. You can imagine this. How can you imagine this? Is that like if you are facing towards this screen. All right, if you are facing towards this screen, you can imagine there is laterally a ramus of the mandible, and medially there are medial structures inside us, right? So that inside us is pharynx obviously, and tensor veli palatini is a muscle, and then lateral pterygoid plate, that is also the inside structure of the sphenoid bone. All right, so that is how you can imagine, and this will make the anterior wall, and that is made by posterior and infratemporal surface of the maxilla, and this is the posterior wall made by tympanic plate, mastoid and styloid process. All right, so that is how four different wall are formed. All right, so there will be superior wall, and this superior wall will be formed by the greater wing of sphenoid bone and temporal bone. So that is how we make the walls, and this is how a infratemporal fossa is made. And talking about the contents of these fossa, there will be muscles. Muscles are the muscles of mastication. You can remember the muscles of mastication, and that are lateral pterygoid muscle, medial pterygoid muscle and temporalis muscle. So these are the muscles that will be in there, and there will be vessels. All right, so these vessels are maxillary artery. You can remember, like, it is very logical, isn't it? Because there is infratemporal fossa. This is all in the head. Alright, so that is the maxillary artery, pterygoid plexus, and the nerves. Talking about nerves, this can be like mandibular nerve and chorda tympani, lesser petrosal nerve, and then otic ganglion. So that is how our infratemporal fossa completes. It seems pretty easy by like this. Alright, so talking about the pterygopalatine fossa, this right here forms the pterygopalatine fossa, and this is a very important structure clinically and also in the exam point of view. So we have to make it very easy to learn also. So talking about that, let's begin. We will be making just like that, but there will be an inferior wall for this pterygopalatine fossa also. We will be making just like infratemporal fossa, but there will be inferior wall also. So you can like look at it right now. This makes the lateral wall just like the previous one, and that is made by the pterygomaxillary fissure, and this is made like the medial wall, and the medial wall is formed by the perpendicular plate of palatine bone. And then this is the anterior wall made by posterior wall of maxillary sinus, and this will be the posterior wall made by the pterygoid process of sphenoid bone. Alright, so that is how the four walls have formed. Now talking about the superior and inferior wall, there will be, this is the superior wall, and this wall will be formed by the inferior orbital fissure of the eye, alright, because obviously that is very logical. And then this is the inferior wall, and it is formed by the palatine bone and palatine canals. And I have put a dotted line in there because some of the people, some of the textbooks have written that there will be an infero-medial wall. Alright, so inferior wall and medial wall have been fused together to form a single wall, but that will be very hard to depict in a picture, and that is why I divided it into inferior and medial wall to form different structures and a very convenient picture. Alright, so you can draw it like this in your exams also, don't worry about that. So that is how we completed our walls. Alright, so now talking about the contents, there will be a lot of fissures and fossas inside these walls. Alright, there will be connections between different organs in these walls, and talking about that, there will be a fissure in the lateral wall, and this lateral wall fissure will be called pterygomaxillary fissure, and there will be structures passing through this wall. Alright, so the first structures passing through this wall is maxillary artery, posterior superior alveolar nerve, artery, and vein. So four structures have passed already from these structures. Alright, so there will be a fissure in the medial wall also. Talking about that fissure is called sphenopalatine foramen, and there will be different structures passing through that, obviously by the name sphenopalatine. So sphenopalatine artery and vein will be passing from that, and nasal branches of the maxillary nerve will also be passing from that. Alright, so talking about medial wall, again there will be another fissure right here. That fissure named C obviously is a pterygovaginal canal, and in that canal there will be different structures passing again. The first one is like it like brings a connection to the nasopharynx. Alright, so that is the crucial point of this. And talking about fissures and canal in the posterior wall, there will be a Bedian canal, and obviously by the name there will be Bedian artery, vein, and nerve passing through that, and there will be another canal or fissure in that posterior wall again, and that is made as foramen rotundum. You might have heard about this a lot. And then this foramen rotundum, there will be passes of maxillary division of cranial number 5. So if you haven't studied cranial nerve 5, we have a video on that. You can look at that in our channel obviously. And there will be another canal in inferior wall also, and that is called palatine canal. Alright, so that from that structures there will be the passes of palatine artery, veins, and nerves, like that there is a typo in there. There will be nerves in there, and descending palatine artery again. So there will be different canals in the superior wall. Alright, so there will be superior orbital fissure first, and passes are supraorbital artery, vein, and nerve. And there will be inferior orbital fissure again, and the passes will be infraorbital artery, vein, and nerve. and zygomatic branch of maxillary nerve. There are a lot of branches of maxillary nerve, all right? So that is why there are a lot of structures passing through a lot of canals. So you might get confused, but you can remember like there will be one, like in lateral and inferior wall there will be one fissure, and in medial, posterior and superior wall there will be two fissures, and there will be structures passing through that. All right, so that is how we come to Pterygopalatine Fossa. Now talking about Ischiorectal Fossa or Ischioanal Fossa, you might think this is very confusing to be remember, like to remember and draw in the image in exam, and this is also a very important topic for the exams also and clinically also. All right, so this is the Ischiorectal Fossa. You can see there are two halves, and we have like a detailed image in a single half of the image. Now in the right side we'll be trying to make exactly like that, but in a very convenient way. All right, so let's begin drawing. Grab another piece of white paper and let's begin. So first of all we will be making lateral wall. All right, so this right here is lateral wall, and this is obturator internus muscle. All right, so there will be ischial tuberosity working on it as the lateral wall also. So this is ischial tuberosity, and the fascia covering this obturator internus muscle will be obturator fascia. Obviously that is how we complete our lateral wall. And now let's talk about the medial wall. So medial wall, this is the medial wall, and the muscle is levator ani muscle, and there will be another muscle working on that. This muscle is external sphincter. All right, so that is external sphincter, and there will be the fascia like this of the levator ani muscle, and that is called levator fascia, to remember in a easy way, or fascia of levator ani if you have confusion, to remember like that. So there will be another fascia of this external sphincter muscle, that is external sphincter fascia. That is how we complete our medial wall. All right, so you might get confused here that this levator ani muscle should be superior wall. All right, so but that does not occur like that in reality. In reality there will be for this image is just for the convenience, right? So these structures aligned together to form medial wall in the reality. So that is why we are making like that, and there will be this apex by the like binding of medial wall and lateral wall. There has formed a pointed apex in the top, right? So this apex right here is the meeting point of levator fascia and obturator fascia, right? So that is apex. And talking about the base, there will be a skin, and that skin is called perineal skin. We'll be talking about the perineal body or perineal diaphragm later in another video. We'll be talking about that for sure. And then there will be fascia, more fascia to this. This right here is another fascia. This is another fascia. This is another fascia, making connections here and there, hither and thither. All right. So these two fascia combining together will form fascia lunata, right? So that is fascia lunata, and this is another fascia. And that fascia is perianal fascia, and this is a covering making Alcock's canal. That fascia makes Alcock's or pudendal canal. There will be different structures in that. Talking about contents later, we'll talk about that. Now that is how the fascia has completed, and that Alcock's canal or pudendal canal is formed by the covering of falciform process of sacrotuberous ligament. You have to remember like that. Then this is just a connection right here. So talking about the spaces, there will be two spaces mainly, and the first of that is this M region, that is ischiorectal fascia, and then the N region, that is perianal fascia. All right, so talking about the contents, the most important parts right now. So there will be a lot of contents. This right here, these three things right here are posterior labile in female, or scrotal in male, artery, vein, and nerve. These three structures pass through ischiorectal fossa. All right. So these three structures right here will be labeled P, and that are inferior rectal, artery, vein, and nerve. Artery, vein, and nerve. Everywhere you have to put artery, vein, and nerve. All right. So there will be this another nerve here. This nerve is perineal branch of S4. All right, so there will be these different regions. These yellowish structures are fat. All right, these are the fats. Ischiorectal pad of fat. All right, so these red structures, dotted structures in here, these three structures are the internal sphincter. All right, that is how you had to remember. And this Q region. So we have made the pudendal canal also, or Alcock's canal, like that, and I have put that in a structure right here in the corner. And the contents are obviously radius artery, that is pudendal artery, and vein, and then pudendal nerve. So this is the Alcock's canal, and this is very important to form like gain the pudendal block during pregnancy. This is very important, and you have like this ischiorectal pad of fat in a very huge amount in both sides of our buttocks, and that will help to do the defecation, to compress and relax, all right? So that is how ischiorectal fossa will be there, and there will be a connection between ischiorectal pad of fat in two different regions, right and left regions, and thus the infection in one region will spread to the infection in the other side. All right, so that is clinically important, very much important. That is how we cover up these 5 important fossas of our body. So I hope you get it better. I hope I have made it clear, and thank you for staying with me, and please subscribe and share for more like banger videos like this. Thank you.